All right, good morning, everyone. So this is episode 6 for me on Sunday Morning Coffee with Dr. Marron, and I have a very special guest for you guys today. I'm going to introduce you guys to Dr. Miguel Villacorta, and he is a dermatologist. I like getting a multitude of different professions in the healthcare industry on here for many reasons, but I think one of the biggest ones is that we need to learn how every healthcare professional does tie into one another at some point. And that's why I'm so excited for you guys to meet Dr. Miguel, have him introduce himself and his story. He's got such a tremendous background and he's such a knowledgeable person. So I'm very excited to have him on here today and share how he got into what he's doing, where he's at, and where he's going. He actually just opened up a practice across the hall from me in our building down off of Broward Boulevard. So he's literally right across the hall from me. And we've grown to really enjoy each other over the past year, right? It's been a year now or so. And he also started this whole career path of opening up his own business during COVID. So we'll get into talking about how he's been dealing with that, since I know a couple of followers that I have opened businesses during this time, and you know, they're dealing with a lot of pros and cons of that as well. So I'm going to have Miguel come on, introduce himself, and we're going to go into your story and how you came to Galt Dermatology.
Hi, everyone. Thanks, Christiana, for letting me be on your show.
Very welcome.
Thank you. I'm Dr. Miguel Villacorta. I'm a board-certified dermatologist. I practice in Fort Lauderdale, right across the hall from Dr. Marron's practice right there in just north of Las Olas. And so, yeah, I'm the only doctor, because we're a small practice, for Galt dermatology, and again, serving just everyone in Fort Lauderdale. But yeah, to kind of touch on some things you said, my path to being a dermatologist has been a very non-traditional one, to say the least. I started off as an electrical engineer, if you can believe that, and my first job 20 years ago was with NASA, doing 2 launches. So STS-104 and 105 were my missions that I helped out. The airlock on the space station was the first mission that we helped. So, but that was 20 years ago. There was no Elon Musk, and there was no going to Mars or the moon. Saw the writing on the wall, and didn't see much of a future at NASA, if you could believe that. But again, that was a long time ago. Left all that, changed careers, did business development, kind of looked to improve my skill sets in areas that I knew that were lacking in healthcare. You know, the age old, doctors are not good in business because we're not trained in it. And so I had to basically get some experience elsewhere before med school. And then I did the traditional, med school, residency, and then just jumped straight into starting my practice. And so we're trying to do something a little different. We see very few patients a day, but we actually spend time with our patients, which I think is lacking in today's healthcare. That's a whole other conversation we can get into, but hopefully patients like it and patients see the value that we bring, and we're trying to do some things different, especially now with everything with COVID. People want quality and they want to be better taken care of. So I know that's a lot of kind of what you do in your practice as well. And so I think we have a lot of similar values. So I think we see very eye to eye on those ends. So hopefully it helps out both our patients.
100%. I think that's a great point to make, because this path of running a medical practice without taking insurance or being about the patient is also hard to start off. When I started it, I had a lot of people being like, wait, what? You don't take insurance? What? And when you start building that quality rapport with patients, I mean, I've been open for 5 years now, and most of my practice, my, incoming patients are all word of mouth. I rarely do the marketing anymore. I have the Instagram and I have the social media and stuff like that, but I barely touch marketing anymore, because really what I'm doing, putting out on the internet, is just that. But like you said, the quality of care in today's day and age, unfortunately, has gone down the hill. And like you said, we could get into a large topic on this, and maybe I'll have you back on so we can have a subject to talk about this. But
there you go.
If I learned, when I came out of school, 8 years of school, and all of a sudden you're like, man, I'm miserable, and I spent all this time getting this degree, working my butt off to get to this point, and I'm not using my skill set, and I'm not helping these patients. And if it's not going to change from the top down, we'll change it from the bottom up. So I commend you, because it's such a hard thing to step into, a patient one-on-one centered care, especially in dermatology, where, I mean, even physical therapy, usually it's like a mill, right? You're in and out with the patient in 5 minutes. And, I've sent you multiple patients, and every time they come back and they're like, it's the same thing like you. He spends the time, he breaks it down, he doesn't rush me out of the room. And that builds more, quality of care. It builds more for the patient and trust in you than it will in anyone else. So, and I, to be honest with you, I haven't heard of a dermatologist going this route either.
The first one that it's called, the model is called direct care dermatology, which is a take on the direct primary care movement, which has gained a lot more popularity across the country. But a lot of dermatists don't do it because you can make more money just doing skin mills or seeing a lot of patients per day and taking insurance. And while that has that benefit, I just don't want to practice like that. I'm trying to do this new model, and I'm the first in South Florida. I think there's one more that just started not too long ago, so hopefully it gains traction. But I do take Medicare just to basically make ends meet, because not enough people know about this model yet. I'm still marketing. I'm still doing all that because I've only been in practice year and a half. Just before COVID we started, which wasn't the best timing, but it wasn't the best timing for anybody in the world, essentially. But yeah, it's like you said, it's trying to provide a different model because patients want it. I mean, we're all patients too, and I see it too. When you go to the doctor and they're so busy just because of so many other reasons that they don't even have time to look at you in the eye and talk to you like how it used to be. And it's that patient-doctor relationship, which is the core of medicine, and we're losing it in this country. So there's a few of us that are trying to gain it back. So we'll see if it works.
It definitely will, because it's, this type of centered practice is starting to gain more popularity from what I see on the internet. I think that we will be the forefront of maybe insurance changing. I don't know, but it has to at some point, if more patients are going to start paying for stuff out of pocket, or find practitioners that actually take the time with them. I know a lot of people that will just avoid going to the doctors at all costs because they don't want to deal with someone who doesn't care. And now you're talking about things that are getting misread, or, cancer going by and you're not catching it. And that's the other thing, is like a lot of these practices, they spend 5 minutes with a client, they're rushing through it. They have 2 other people looking at the patient, and then things are getting lost in translation, misdiagnosing and all that stuff.
The coordination of care is difficult. Like you said, things are getting lost because we're just too busy and we don't have time to really do things how I think we should be doing it, or how we were taught in med school, essentially, when we actually did have more time. And also the financial end. A lot of patients don't want to go because they have these high deductibles or no insurance. They don't know what it's going to cost, and so then the access to care goes down. But in certain other countries, there are people that, like other countries, that do have the insurance model, and then patients decide if they want to just pay out of pocket or go with private. A lot of countries in Europe, they have essentially a Medicare for all system, which a lot of population uses, and a lot of people use that, and some people go to the private sector. So it's just a different model, and it'd be interesting to see what happens in this country in terms of how it may play out. And this is not going to be a political discussion, but it's just the reality of how medicine is changing. And look at COVID. How much has changed? I mean, now it's all virtual, or not all, but a lot of it is. That didn't exist a few months ago.
No.
So the whole industry is changing.
The other thing I was talking about with someone else recently is that, look at the science, right? You and I are very evidence-based. We read research, we're up to date. When you look at a treatment, just for instance, we talk about dry needling, that's something I recently got into. For the protocol to work, what they're saying, what is effectiveness, right? The treatment's got to take 20, 30 minutes alone. You're not talking setup time. You're not talking insertion of needles. You're not talking prepping the skin. You're not talking about all that other stuff. So all this evidence-based stuff is coming out, but it's not tailored to most of the population, which is these mills. And again, it's like, yeah, are you up to research or no? Because you're really just avoiding the fact that there's all these, things that are up and coming, but we can't even treat like that. And that was where my frustration came in, is like, I'm learning all these great tools and things by reading all these research articles, but I can't use it. It makes you feel useless.
It does. And if you think about it, all that comes because when you do the studies, you have a very controlled study and you're able to take the time. But then taking that and putting it into practice, sometimes there's a disconnect. And that's the challenge, and I think, you're able to offer those services because of the way you practice. But sometimes if you, like you said, if you try to make it fit into a practice that's not geared for that, you're just going to offer subpar services, or you're not going to get the results that either you or the patient either want or need. So it's interesting.
Yeah, no, you're 100% right. How did you in med school even get into, like, how did you go down the dermatology route? Because it's interesting, like, going from, now in PT school, I remember being in school with people who had like major career changes. They were like teachers or worked for Apple or something like that, and they switched to physical therapy. And I was always interested in, like, how did you just switch from engineer to interested in dermatology, especially with all the other stuff you learn in med school?
I actually started in med school just wanting to be a doctor. I didn't know what kind of doctor. I didn't know what subspecialty, if I wanted to even subspecialize, and just trying to learn the basics. And I was like, all right, first I need to learn all of medicine, or as much as I can, and then I'll figure out what I want to be in. And some people start off like that. Others, they start off, they know exactly what kind of doctor they want to be in, and that's great for them, but I didn't know. And I want to keep an open mind. But the more I did my training, I started to narrow down areas of medicine that I just really enjoyed. And once I started getting into the skin, I mean, one time we went on a trip graduated from Nova Southeastern. We went to Vietnam, and there's a lot of skin issues. I saw people with all sorts of like scars from the napalm burns from the Vietnam War. I saw people with all sorts of diseases that you wouldn't see here. And that kind of sparked my interest. But then the more I got into it, I realized I could see patients from birth to end of life. I could do medical, I can do cosmetic, I can do surgical. So to me, it was very, it wasn't very monotonous. My days are filled with all three. And there's over 3,000 conditions in the skin. So I'm a little bit of a masochist for education. So I think I just jumped headfirst into that one. But even the immune side of it, my mentor, Dr. Nassari, he's quadruple board certified and one of the leading experts in immunoderm. So the other day, someone came in full of blisters, and this is serious medical dermatology, and we were able to get her a diagnosis, and now I have to basically modify her immune system, controlled, to basically control her blisters. It's those are the exciting ones, those aren't your acnes and your warts that you get all the time too, but that's the serious medical dermatology. So it's a mix of just the type of patients, the type of work environment. I could still have a practice on my own, and then just be able to help all ages. And so that's kind of how I got into it. And the more I got into it, the more I liked it. And it got to a point where I couldn't see myself doing anything else. It was either skin or nothing. So
that's beautiful too. And you have now 3 brand new baby boy.
I do.
So how is running your practice with 3 kids and being a busy dad?
I'm on my 5th cup of coffee right now, so it's not even a work day. But no, it's going well. Victoria's 14, Anaya's 2.5, and Aiden was born. He just turned a month. So that's why I'm outside, because if I'm not, you might hear him screaming if he wakes up for his bottle or his diaper change. But it's thanks to my wife. She's the one that's supportive, and thanks to her, she helps out. She's also a physician too, so we're juggling as well. But it comes down to just having a good team at work, having my partner, my team at home, my wife, and basically just we manage it, and we have to just basically put the family first and do the best we can. And if I may not be able to see, as like I said, as many patients, but I'm okay with that.
You have a great staff over there. You really built a nice staff for yourself over there. I love going in there. I mean, I see
Yeah.
you guys all day, so I'm biased, but you really do have a great staff over there, and they love
Thank
being
you.
there.
That's critical for me. It took a while to find a great staff, but we take care of them. And to me, that's one thing I learned from seeing my parents. They had a business in a different industry, and I saw it when they had good employees and people that were engaged and wanted to work. It made such a difference. And we're small. I have 3 other people in my office and one that works from home. But thanks to them, I can do this, because if it wasn't for them, then I'd be pulling my hair out.
Probably, but that's what you said before, is with a quality team, you also take care of them. And I think that's another thing that people in owning a business need to understand is like, yeah, you can bring great people in, but you also have to give them a reason to stay there too. And you do. You truly take care of those girls.
I do, and they take care of me. They're always making sure that I'm drinking water because I forget, or they're like, Doc, have you eaten? It's like, no, I'm grinding through lunch. They're like, no, you got to eat. You got patients that you got to take care of yourself before you can take care of your patients. And so they stay on top of me too. So we help each other out.
It's good. So how did you deal with? I mean, I really give you a lot of credit. How did you deal with opening this business during? I mean, you really just opened it and then COVID hit. So how did you make it through that? Like, what was your biggest thing to get through all this?
Biggest thing is I think learning some business beforehand helped. I kept costs very low. The PPP loan that I took out helped, so I didn't lay anyone off. Everyone received a paycheck even though we were closed for 2 months, and so I used the opportunities we had to basically keep our small business open. And during that time, I sat at home and built the website from scratch and doubled down on the marketing aspect. The doctor who I bought the practice from, Dr. Babinski, has a great name in the community, and he helped out. And honestly, it was just helping out those patients and the loyalty that they had to our practice, that once we reopened, we were able to kind of get up and running bare bones until we were able to kind of slowly pick back up. And so I think it was just a combination of all that. And yeah, I think the biggest thing is you see the biggest companies that have a real large overhead, they're the ones struggling more. I mean, how many restaurants do I see are just closing up? But the little ones, the little mom and pops, are staying open.
I was truly grateful with my model during this time. I went to maybe half the amount of people I was seeing in the beginning of, when COVID hit, but I was grateful that Florida Health Board still, deemed me essential, especially because a lot of people had just had, surgery, and it's like, you can't not move your knee after ACL surgery. You cannot, get work done after a major surgery. So I was really grateful.
I have 6 screws in the shoulder, and PT helped, because if not, I'd be locked up. So
right, yeah. So I was just grateful that I look back and I'm like, I feel like I opened this business perfectly at the right time, because I would have been laid off. Like, a lot of friends that I had, the businesses were shut. They couldn't pay the income for these PTs. And I'm just so grateful that I was able to push through that and work through that, because if I didn't have the type of practice I have, I don't know where I would have been during that time. But, more people, as this COVID thing kept going on all year, more people trusted this one-on-one centered practice because they felt safer, So that was the other, pro, especially now for us being back open, to have these people be like, oh, okay, he's one-to-one. I'm not in there with 10 other, people running in and out of the place. So I know more people are, about this one-on-one centered model. So I feel like that also kind of helped us a little bit too.
It did. And so essentially, thanks to our patients who basically kept coming back, even though, when they were nervous about COVID and we opened up, we both took measures to try to keep the office safe. And it's interesting. I even tell other people, I go, I wonder if the future doctor's offices, they may not even have waiting rooms anymore. So just the whole model is changing. It's really it's really crazy how quickly everything's changing.
Yeah, a lot of things, even from a therapy aspect, like, psych therapy and stuff, they're doing all this online now. It's nuts.
Yeah. So we'll see.
Yeah, we will see. All right, so let's get into a couple of these questions. I didn't want to overwhelm you with all of them, but you had gotten actually a lot of questions from online people.
That's
So
great.
yeah, no, it was actually really awesome. And I'm definitely going to have you on again so we can go through more questions. All right, so let's start at the top. One of the biggest questions someone had was, and I had, I think, a couple questions for this, but I just kind of shoved it into one. They asked, what did you recommend for hormonal acne? And I think they're talking about, acne under the chin, the neck and stuff like that. And is there really like a skincare routine for it? Is it more like you have to get your blood work checked? And what do you honestly recommend for stuff like that?
So I get this question a lot, and Christina, cut me off if I go off on a while, because I tend to over explain.
You're
So
okay.
just cut me off if that happens. But when it comes to hormonal acne, the first thing I always tell patients is, let's make sure it's acne before we start running down like a rabbit hole, and then maybe it's not, because rosacea can look just like it, and there's other skin conditions that can look just like it. But assuming it is, then I think having a good skincare regimen definitely is a good foundation, but you definitely want to treat it as well. And this is where some women tend to, if they're on birth control pills, it can help. Um, if someone either can't or doesn't want to be on birth control pills, something that's off-label is spironolactone, which is actually a blood pressure medication. And if you have normal blood pressure, your body, it's not like your blood pressure drops or anything like that. The only thing you have to be careful with is vitamin K, because it works with that. So I tell patients that are on it, they can't, they should be careful with the amount of spinach they eat, or leafy green vegetables, coconut water, bananas, things like that. And also, if they're pregnant or become pregnant, they can't get on it, because if they have a male fetus, it can feminize the male fetus. So
Wow.
it's like with anything, it's not like it's, oh, here's a pill, have a nice day. You definitely do want to have that conversation with the doctor, and definitely talk about it and see, what's best for you in your situation, because everyone's different. But that tends to help. And again, a good topical um, antibiotic, a retinol if your skin can tolerate it, all that can help. And again, it's also very normal in a lot of women to get that one pimple right either before, during, or the week after their period. And there's other things we can do too, but the biggest thing I always worry about is if they have like polycystic ovarian syndrome, which is something that you can check with blood work and with ultrasound, and it's common. And if that's the case, then with like an endocrinologist, you can also, like you said, work with other aspects of medicine. Sometimes we have to tie into other specialties. So sorry if
Yeah.
that was a
No,
long-winded,
no, that
non-direct
was
answer,
actually
but
really a great answer. And I didn't know that about the fetus. I'm a patient of Dr. Villacorta's, and I haven't gone to you because of this, because it's actually cleared up since I turned 30 for whatever reason. But I struggled with hormonal acne forever. I went on birth control when I was 16, and it cleared up. And then I started bodybuilding around 21, 22. So I gotten off of it. And then I had ended up going through breast cancer, which was all hormonal. And then, I couldn't go back on birth control because my breast cancer was ER positive. So being off of it, I found all of a sudden I started getting like, cystic acne under my chin, being off of everything.
mm-hmm.
And it was before I had met you, I went to this place in Boca, and they had put me on spironolactone. And I just remember I took it at night and I peed a lot. I was like,
Yeah.
but no one told me what you just said, which was the vitamin K stuff. So it makes me wonder, like, what the heck I was doing during that time. But what's funny is,
Yeah.
like, one of the other questions that I'm going to tie into this was, someone had asked, could diet and water intake be affecting my skin? I remember eating so clean for so long, and all the water and stuff, and it didn't matter. Like you said, it was straight during the week before my period. I always got it all like breaking out over my chin, my neck, the scarring and stuff. And I just this year, like, stopped having it. Like I'll get one little one, but it's just crazy.
That's the little one that always comes up every now and then. But
Yeah.
it's, yeah, at around 30, I tell people you stop making new moles. And if you have acne, typically it clears up, but then you start making, you might make new things now that
Yes.
you're 30. So, so
Which we've
I just turned
learned.
40. So, so yeah, trust me. Little
So
things are,
yeah, so it's so true. So what do you say to people who do believe that like diet and water intake, like what I guess what type of acne do you see if someone has a poor diet and low water intake versus someone that does and struggles with
so
acne, I guess.
yeah, so diet and water intake definitely do affect the skin, and I have seen it in patients. I've even had some patients with very, very poor eating habits, and I can even tell in like the texture of their skin. I can feel their skin, and I know something's off. But in terms specific to acne, the studies that are out there have shown that that water and food doesn't necessarily affect acne specifically, except for some strange reason, skim milk, like high amounts of skim milk and high glycemic index diets has been shown to increase the amount of acne a little bit. But I tell patients, even if if they don't have any dairy and if they're eating great, you can still get acne. So it's one of those, it's, if you're going to build a cake, it's not the actual cake, it's like the cherry on top or
Right.
the icing. So it's a good in addition to everything else you're doing. But in terms of diet and water intake, yeah, it does affect the skin and in many other ways.
I do believe that because there's this he's a chiropractor, Dr. Perry Nicholson. I've been a fan of his for a long time, and I'm actually going to take one of him. He does a lot of lymph therapy, like lymphatic
Mhm.
system therapy, and there's been a lot of stuff I've been studying. And one of the things that he had said that got to me with skin is that, you know, he talks about lymph and he says like, break it up in thirds, like a big part of the third, the lymph is in the neck, the other third is like by the liver, and then the other big third is underneath the skin surface. So he says like if you have a poor filtration system, he equates it to like a body aquarium, right? So like our body's the aquarium, we have the organs and stuff inside of us that's like the fish and coral, and all that could die out and I could place it all back in, but if I still don't fix the filtration system, that lymph system, that's going to appear on the surface of the skin. So he does a really good job in tying in some work with patients who have like chronic pain and chronic inflammatory responses, and he sees stuff on their skin, like you're saying, where you can tell by the texture of the skin or the way it looks that there's obviously something not filtering correctly in his or her body that's showing on the surface of the skin. And
It's
that's
true.
what
And
I believe what you just said, which is very true.
it's really interesting. And even sometimes the skin can give you clues. Sometimes you might have a rash or a certain thing that can point towards something internal. And so it's even, yeah, this, the whole cliche, it's the largest organ of the body, sure, but it's still an organ of the body and it's still connected to everything else. And so, everyone asks me, even stress, oh, does stress cause anything? It doesn't necessarily cause it, but it makes everything worse. So last year during COVID, everybody was itchy, everyone had flaky skin, and everyone had more dandruff. And they're asking me, why is this happening? And I go, stress can play a role in this. And so everyone was just very stressed out with COVID. So it's and yeah, people were, their eating habits changed, and so yeah, it's all connected. And so it's, you got to play, everything has to basically connect, and you got to do everything together. So
I think it's amazing that you can tell by someone's skin texture. The only thing I can talk about working on everyone's skin, that's why I'm excited to take this guy's course. But I think the one thing I noticed, because I work with a lot of bodybuilders and I was one myself, is you can actually tell the difference in the texture of the skin with someone who's on steroids versus someone who's not. Not only by the hardness of the skin, but just, I can't really explain it. It's like, it almost feels like not snake skin, but it's just different. And I just know. And like, I'll always ask, when I'm palpating, I'm like, what are you taking? Because they might not put it on their medication list. Obviously,
mhm.
it's not prescribed, but they'll be like, oh yeah, I'm on this, that, and the third. And I'm like, okay, it makes sense because not only do they look ripped and stuff like that, but you can feel the texture of the skin. So, you know, overuse of that stuff, you wonder like why when old bodybuilders retire, why their skin still looks kind of nasty afterwards. And it made me fear like continuing on bodybuilding.
No, and even not only just the supplements that some may take, but even just water, like and you can tell, I've never been to a bodybuilding competition, but you can tell me right before a meet, I know a lot basically cut water, and they're trying to be as lean as possible. Look at their skin, feel their skin, look how it feels differently, because they have no water for I don't know how many days, a day or two, I guess.
It's pretty much like you water deplete the week of, and then there's nothing for about a day and a half. But some of these people also take a diuretic.
I know.
So yeah, it's like snake skin. Like that's how it's like, you know, thin snake skin. That's how I equate it. And it makes you think like over time. I'm like, I'm very grateful that I got away from it. I loved looking the way I looked, but we talk about like aging over the years and continuing to do this. You know, I want to be the grandma that looks nice. I don't want to be the grandma that's got, you know, creepy skin.
What's actually really interesting, if you look from an ethnicity point of view, Asian skin tends to be the most delicate, but the most hydrated. It's just as a random aside, but it's really interesting that a lot of people from Asia, they tend to age very well. And again, I think it's a lot of it's mostly genetics, but it's just kind of as an aside. Different ethnicities have different texture and different properties of the skin. Asian skin tends to be the most hydrated overall, if you will. So they have the most ceramides, you know, and everyone's talking about the ceramides, a new buzzword. As we get older, we lose ceramides, and we just can't retain water as well. And so, you know, a lot of my older patients.
Right, and then look at it from the diet aspect, like those typical people in the Asian side of the world, they eat so healthy, fish, you know, miso soup, lots of, you know, filled with like probiotic type foods. They eat very clean, more fish, you know, more water based, and over the years, yeah, definitely, 100%. I think so. All right, so actually, we'll go off of that, and we'll talk about tying a couple of questions, because I know that you do Botox, so we'll talk about how you got into doing Botox, and people had questions about fillers and stuff like that. So biggest question I had was, how can you slow down the signs of aging, and tie that into, does Botox truly do that? And what's the difference between Botox and fillers?
So the way we naturally all age, like in our 30s, we tend to see changes, or you may start noticing changes in your skin texture. In our 40s, we start to lose some fat from our face. And so, for example, I tend to have less on this side. So you see a little line on my nasolabial here compared to my right. So I'm slowly losing a little bit of fat from my face. And in our 50s, we start losing bone. That's where everything attaches to. That's where, as we lose bone from our cheek, you get the inverted triangle. Our orbit gets bigger, so their eye socket gets deeper. Your gums recede. Your jaws start to recede. And so you get the jowls. So there's not much we can do about just the way we naturally age, but we try to do things to try to basically hold off and age as gracefully as we can. And so that's what I always try to tell people. We live in a world now where we're trying to manufacture beauty instead of enhancing the best that we can be. So that's kind of how I do it. But genetics is something we can do. Diet and exercise helps. If you've noticed, even not just on the face, but in the body, maintaining a steady weight throughout your whole life, you have less laxity of skin. And so people that maintain a steady weight their whole life tend to look better versus gaining all that weight and losing that weight in those crash diets. And then, yes, all the cosmetic things for the skin texture. And I guess this is kind of goes back to the three things that I like to usually tell my patients based on how we look in rejuvenation. Skin texture, that's with a skincare regimen. The estheticians can do things like microneedling or chemical peels, and then lasers. That's what that works on. Botox or Dysport, those are our neurotoxins. Those relax muscles. So it's muscles of movement. So I'm all out because I don't inject myself. So all my lines are back. So these lines are back. And those are the dynamic lines. And so that helps to kind of help with those. People get the crow's feet a lot. And then filler, that helps to basically add volume. And a lot of people get filler and Botox. There's lots of stuff online. They may not know the difference. They might get confused. So a lot of people ask me to put filler on their forehead. And that's something I don't do. To me, it's extremely dangerous. Even the liquid nose lift is something I don't do. There's a little blood vessel that runs from here to the back of the eye called the ophthalmic artery. A little bit of filler in there, you go blind. So it's just something I don't do, but done safely and properly with a good board certified dermatologist is effective for helping the signs of aging. And so we do it a lot. So we tend to do Botox and Dysport up top typically, and fillers in the bottom. And again, we try to basically fill in some of that loss of fat, fill in that loss of bone after our 50s. And that's, we basically learn to age gracefully with a little bit of help.
You know, a lot of people don't know that I just got it done recently by you. And when I tell people, now I did my forehead, I did my 11 lines, I did my eyes. And people are like, what, really? And I'm like, yeah, see, it's not like a lot of people think that you hear those horror stories of people like freezing their face, you know, and I say, I'm like, look, if there's anyone that I don't think in my life I ever thought I would do Botox, or the Dysport, I'm like, look, I don't trust many people. I'm like, I trust this guy. He does it very gently. He does it very smoothly, and he will not freeze your face. He will not mess your face up. But you're right. There are big horror stories out there where you see, I don't even know how it gets that far. But then again, in any field, there's the troublemakers, you know?
Well, thank you. I mean, I like it so that you look natural. And I'm just helping a little bit. I do have some patients that walk in and say, make me look frozen. But those are few and far between. Most people say they want to look natural. And that aligns with kind of how I like to do it. And I say it's perfect because that's exactly how I want to do it. I don't want to basically manufacture anything. I want to make you look the best you of you, you know?
Oh, 100%. So let's talk about this question then. What do you recommend for varicose veins? That was, now I think we should also have you explain the difference between the different types of veins, because you even just taught this to me the other day when I was in with you, which there's spider veins, there's varicose veins, and then the other one, I forgot what you said the name of it was. It's like the in-between one. Like, how would you manage it?
Yeah, I mean, there's different, like a spider vein is just a very superficial, small veins. They're just the way they look, so we call them spider veins. But the best way to think about it is in terms of size. You have the little superficial ones, the ones that are very deep, which are larger, and then the ones in between that basically connect the two. And if someone has the very, very, very deep, large veins, there's not much that a laser is going to do in sclerotherapy, where we either inject like a substance. There's different types, but that helps to destroy it. You're not going to do that with the very large veins. For that, it's either a vein center. You're looking at possibly surgery, and that's usually what helps the larger veins. The smaller veins up on top, that's where, like I said, lasers can help, or sclerotherapy can help. But if you have one of the larger veins underneath that's feeding those, you're going to just make more. If someone's on their feet or overweight, or if you look at one of your parents and they have it, odds are you're going to make more. And that's where like compression socks can help slow things down. But the two biggest things are the little superficial veins, which is more of what we deal with in derm, is lasers, and the sclerotherapy is usually what we do. So
I think one of the biggest questions I have myself is with the spider veins, the big ones. I have patients that have had it where like it wraps around the knee or something like that. Can that be a source of pain if, testing wise with the knee, there's nothing wrong? Can it affect knee pain? Like if it were to wrap around the middle of the knee or something like that?
It's unlikely that the actual vein would be causing the pain, but it would
Okay.
be really interesting to like when if I would see that, I would kind of ask, okay, why is there a vein in that area? Was there a history of trauma to the area? Is there something underneath that the body has generated additional blood vessels? Maybe there's an area where there's an injury and the body's trying to heal. Maybe not, but I think it would warrant at least looking into it. So that might be a clue in terms of the skin maybe trying to show you something, especially if it's only on one knee and not the other. Um, but it'd be unlikely that a little superficial vein would cause a lot of pain. There's a few conditions that can be the case, but extremely rare. And
Yeah, I was very interested by it because, there's someone that I had, he has very flat feet. So, he bears weight through the inside of that knee a lot
oh,
and
I'm
probably
all about
over
that.
years. So,
That sounds like me. I'm
and he
always wearing my
had,
compression socks.
yeah, he's got like a massive, and another girl who's got it with chronic knee history. So, now that I think about it, I wonder if you're right. I think maybe if there is pain there and it's been developing, that's there to feed it and possibly help heal it.
Yeah, I mean, I don't know the patient, but if he's got that flat feet and he's overpronating, and then that might be putting additional stress all up the knee and up the hip, could that slow trauma over years and all that weight could be causing some of it? I mean, possibly. I know the inside of my ankles are
Destroyed.
they look, yeah, I see plenty of veins down there right now. So
Yeah, I said it to you when you examined me. My whole left side, I had an unfortunate knee issue since running in college. And if I knew what I know now, I probably would have avoided it at all costs. But my knee now permanently sits sideways because no, my kneecap, because I ran distance for so many years. Back then, there wasn't like athletic training, there wasn't strength and conditioning coaches to tell you like you need to strengthen your hamstrings, you need to strengthen your glutes when you're running all this mileage. And so I find that my left side, I did an X-ray, I don't know, 7 years ago. My lateral femoral condyle shaved down, so my kneecap has to sit outside of it. So that started affecting my hip. So now I have a small labral tear in my left hip, and only my left side has all the veins, like all my IT bands, got all those varicose veins, my calf, like the sides of my ankles. And I'm like, ugh, because now I'm on my feet all day. When I was in school, I sat most of the time. So it's like my legs didn't have this. And now I'm starting to see it, but it makes me think like, is it there for a reason?
amazing. Everything's connected, and all of a sudden, people come in with headaches, and then you're asking them, "Let me see your feet," and they're looking at you funny. It's like maybe your flat feet, are all the way down, all the way up, could be affecting some of like the tension that's pulling the back of your head.
Yeah, there's this course that I'm getting certified, well, pretty much almost done certified in it, but it's called postural restoration. And one of the biggest things, his name's Dr. Ron Huskra, but he talks about like the dysfunction of your feet can cause problems in your teeth. So, let's
Okay.
say like you're a little bit more, your center of gravity is a little more forward, you have less ankle mobility, you're far forward, you're putting in the pressure through the balls of the feet rather than being centered. Your stomach's forward, your low back's arched, but then it says like the protrusion of the jaw can then affect like TMJ, can affect headaches, all that stuff.
Yeah.
So like it makes you wonder, like, and now you talk about skin. I haven't really tied this in until I met you and I started really researching more of this. You're like, wow, okay, maybe you're right. It's there for a reason.
Well, let me know when you finish that course, because my posture's off and my right knee's been clicking for years. So I probably got to come see you and figure that one out.
Yeah, I know you do because I know you have back issues too.
Well, that's good because I've been picking up the kids, and all that, but and also because I need to strengthen it ever since I have to get back in the gym and back to a routine. But
I don't know.
luckily, I don't have any bone issues back there, not yet at least. But it's just I got to get back in shape.
I should just give you a key for my office when I'm not there so you can train in there.
I actually do have a workout bench that I brought in, but I haven't used it yet just because we're remodeling. So
Yes, that's right. You are redoing the whole office, so that's gonna be beautiful. I mean, you've done such a nice job in there already. If you guys go and see Dr. Villacorta, you'll see how beautiful he's made that office. All right, so going off a couple other questions I had here. Moles and other marks at home. Now, I'll add this into another question I had here, which is at what age should you technically be going in for normal skin routine checks? You know, I just had my first one at 30 with you, and it was an eye opener for me to say, I am pale as hell right now, living down in South Florida, mostly because I work now more than anything, but my years of being in the sun as a lifeguard and stuff like that, you can see on my skin that it's changed things, and there's moles, there's popped blood vessels, there's a whole bunch of stuff you showed me. My red arms that I've been bothered by for years, didn't know how to do with puberty. So you've taught me you've taught me a lot about my body in the past week. But talk to us about like the age at which you should start seeing, because I know even kids, like there's rare cases where kids end up having, you know, stuff in their hair, their scalp. Like, what's a safe age to really start going in for regular skin checks, and how can you monitor, you know, moles or marks on your body at home?
So, like I said before, we can make new moles up to about age 30. It's not like our bodies read the textbook and then at age 30 it just magically stops. But around age 30, new moles tend to kind of stop happening, and other stuff starts growing. And anyone under 30, the biggest thing we worry about is the changing mole per se, which is maybe a sign of a melanoma. So that's unfortunately what Bob Marley passed away of at the age of 36, I think 37.
Yes, you said on his foot, right?
He had it on his foot, and I've caught melanomas in the bottom of people's feet. And interestingly, melanomas don't appear, or they appear more often on an area of normal skin rather than a changing mole, but changing moles can have that. So that being said, obviously the sun we get under the age of 20 is the most sun we get in our lifetime. And that damage years later, decades later, is where a lot of my older patients come in with things growing on them. But you can make a skin cancer at any age. Is there a specific age that the American Academy of Dermatology recommends? The studies don't really show a specific age, but almost every derm will tell you once a year, if you haven't had anything, is good just to get checked. Because if you're that one person that ends up having something, catching it early is your best bet. So it's not like colon cancer where we have the studies and they say you should get screened at 50 or 55, or breast cancer, like the mammogram screening. I think it's, my wife knows, she's a primary care. I forgot what it was, 30, I think. 40.
I think it's 30. I mean, I obviously had to get checked because my sister had ovarian cancer at 40. So when I was going in for my yearly, they were doing all the checks and stuff like that. So I guess when you have a family history of it, like you should, you know, give yours prior to. That's the other thing.
Obviously, if you have a family history of skin cancer, especially melanoma, then you should get checked, or at least be a little more observant of your skin. But I tell people at home, and your listeners can look up the ABCs of melanoma. It's all over the internet. There's a bunch of infographics. Derms love talking about it for the signs of like possible changing mole and the worrisome signs that you might want to just kind of look into it. And quickly to go over it, you have asymmetry. So if a mole looks asymmetrical, it might clue you into something suspicious. B is for border. So you might want to have nice round borders. Anything irregular is a worrisome sign. C is color. So moles, if they have one or two colors, it tends to be okay. Once you start seeing 3, 4, 5 colors, that's something to worry about. D is diameter. So the back of like a pencil eraser, for those that remember we used to write pencils in school. So, but basically 6 millimeters, anything larger than that, you want to worry about. E is for evolving or elevated, like a changing mole, or if it's becoming lifted up. And then F is your funny mole. All your moles look the same except that one over there that looks funny. You want to keep an eye on it. And I tell everyone, males, if they do monthly testicular exams, and women when they do their monthly breast exams, if you have a partner, that's the best day to check each other's back. And do it all the same day. And now with phones and cameras, just take a photo and keep an eye on the spot. And if it's changing, then they should see someone for it.
I was gonna actually see if I could show the picture of the one that you just took off of me.
Oh yeah, we took a photo. Yep.
I again, same thing, had it my whole life, never really thought anything of it, but you're right, when there's, I don't know if I can show the camera here, if it'll go, probably not, but you guys can see like the irregularity with that and
Yep.
everything he just said, and the discoloration, like you can see the dark and the light of that. And then this is the brutal picture when he just took it off. But it's amazing to think, I'm 30 and I never thought to go get a skin check, but here we are. And I'm glad I did, because I definitely wouldn't have gone to a dermatologist.
Especially, I mean, that was on your back. You would have never seen it.
No.
So.
And when I told Chris, he was like, that thing's always been there. And I'm like, I know, but you don't know. You don't know. You really don't know. So I'm very grateful for you, and I'm very grateful you're right across the hall.
Of course, of course.
That's a blessing. Okay, so here's a couple of other ones I have for you that were actually interesting. Someone asked about exfoliating. It's a very general question, but what's your thoughts on it? I think I talked to you about this. Because of the Dr. Perry Nicholson, I started doing dry brushing every time before I get into the shower, just for lymphatic reasons. What is your recommendation on exfoliation, and is it good? Is it bad?
I think that exfoliation is good, just not in excess. And I see a lot of patients, they either do too much, or they're putting on way too many products, or they're putting on a product, they only wait a few days to see if they see a change, and they move on. Even like basic skincare, a good cleanser, a good moisturizer, a good sunscreen is kind of your basic. And that's like more than half of what you need right there. When people exfoliate, I see a lot of people overdoing it. And so once a week, if your skin can tolerate it. So what I mean by that, there's some people that have such sensitive skin that when they exfoliate, it makes it worse. Some people are on a retinol at night if their skin can tolerate it. Essentially, that retinol is kind of doing some of that exfoliation for you. It's a very slow type of exfoliation. Some people, they take very abrasive products and they put it on, and they're trying to rip it all off, and they end up getting other things like little milium. They get worse rosacea. I'm seeing a lot of people now, the big trendy thing are the alpha hydroxy and the beta hydroxy acids. There are terms that have, so for example, like a glycolic acid is an alpha hydroxy, salicylic acid is a beta hydroxy acid, and it's just a molecule, but there's a lot of products that are putting it in there now, and it's being used in marketing. And now with Instagram, a lot of people, a lot of influencers are promoting a lot of products. And the question is, is that product good for your skin? Because just because it may be good for someone else's skin, it may not be good for your skin. So you might be over exfoliating or irritating your skin. These are mild acids. So typically I tell people if they can exfoliate no more than once a week. That's typically what I recommend.
What about, and what?
Some people tend to overdo it.
Yeah. You're right about the whole influencer thing. There's so much stuff that goes out on the internet, and you just shake your head half the time, like, this, especially in my world, this will fix your back pain. And it's like, I get these patients that come in and they're like, oh, well, this person had put this on here and now my back's worse. And I'm like, just go to a professional.
It's amazing. Yeah, it's amazing like how many patients I've been able to help just by getting them to use actual less products on their face, and their skin improves. I mean, mind you, if I wanted to make more, I just buy like everyone else. But sometimes I'm like, no, let's slow things down a little bit. Let's kind of take it back to the basics.
We did the same. Yeah, we did the same. I have this guy, Brandon, I'd like to get him on, talk about nutrition at some point, but he's helped a good chunk of my patients who have like serious GI issues. And what he does is he pretty much strips them down to the basics in the beginning to find what foods are actually irritable to them, and slowly implementing them back in. Because you're right, so many people do this over engagement of, oh, I should have this, I should be taking this supplement, I should be doing all this stuff, and then it's it's a toxic environment at that point. So you gotta pull the reins back on some of these people. Less is more in this situation.
And a lot of times it is, and then when we need to, we use it,
Right. All right. So this was an odd question, but I'm kind of interested in what you had to say about this. Someone asked me about laser for oily skin, laser treatment safe for oily skin. I am someone who is straight Italian. Pretty much, I think I bleed olive oil out of my forehead by the end of the day. So what I don't know what they're talking about, but talk to me about, like, I guess maybe they're asking if that helps with decreasing the amount of oily skin.
So I'm going to nerd out a little bit, so stop me if I go too much, because now you're tying in dermatology with the engineering when you talk about lasers.
Oh, cool. I like this.
So in dermatology, it doesn't matter the name or the marketing or the kind of laser. A laser only targets one of three things, and it's either pigments, blood vessels, or water in the skin. That's it. Every laser on the market targets one of those, better or worse. If you're looking for laser hair removal or to remove the brown spots, it's the pigment laser. Like the varicose veins, you're talking about the blood lasers. And for the rejuvenation or for the fine lines or the resurfacing, or in many of what people call the Fraxel lasers, are typically the ones that target the water. So with regard to oily skin, it's not so much oily skin, but what does this patient want, or what are we targeting? Because if not, we're just throwing lasers. What exactly are we treating? Are we treating the overactive oil glands? In that case, I don't know if lasers would be the best for that. That's where typically like a retinol or even like isotretinoin, which is in low doses, can help to shrink some pore sizes and to shrink the oil glands. But does this patient have pigment issues with oily skin? If that's the case, then a pigmented laser can help, and it's okay with oily skin. But the biggest thing we worry about is how dark their skin is. Because if you have darker skin, then you may run the risk of burning their skin. And so you have to adjust the settings or use a different laser, or that's where you really need to know what you're doing with the laser settings. So that's what's more important. So
it's so interesting because we use lasers in physical therapy, obviously, for different things. And I just started recently incorporating near infrared and red light therapy for decreasing inflammation and for mitochondria cell growth. And you're right about, specific labor. And I have to explain to patients why it's not harmful for those specifically because of that wavelength. But we also learned in school, like, different lasers for, like, let's say wound care are different, different wavelengths that you're using. So you're right. If you were to use one specific laser on, let's say one that's more water-based, and you're using it on something completely different, you're going to end up hurting the person. So, people got to really do their research with this stuff. I never really thought about that.
You got to be careful. I mean, now we're seeing a lot of like laser spas, and a lot of places where you can get, come in and get a laser. I had a friend who got a carbon dioxide laser, which is, so let's call it like the grandfather of all lasers, because it literally lifts everything off. It's a blade it destroys your skin. And so now we fractionate it so that the healing time is less. But in the 90s, it would just peel layers off. The downtime is several weeks for that laser, and when used appropriately, it works great. You just got to know how to use it. And a friend of mine, she said, "Oh, I got a CO2 laser and I got a Groupon deal out of it." And I looked at her, I'm like, "When did you have it done?" And she was like, "Oh, yesterday." She looked pink, and slightly pink, like just a little red. And I go, "That wasn't a CO2 laser, and if it was, the settings were so low, it did nothing. They just took your money." Because if you get a CO2 laser for, specifically, you see the effects of it. There is downtime, and it's as if nothing. It was a placebo, essentially.
Going off of that, I know this may be a little off topic, what do you believe about these whole vampire facials that are going around? It's like a whole new trend.
It is a trend. It's technically considered experimental still. That being said, there's a lot of patients that do notice a difference. So it's one of those, even for like PRP, like on the scalp, some people say it doesn't help. Some people say it actually has helped grow their hair. So I think it's so new. We just don't have something very concrete, and there's not something that, I guess, that we need to talk about the science behind it. What they're doing is they're drawing blood and getting platelets out of it. So how much blood do you draw? How long do you spin it for? Because the amount of platelets you have in your body might be different from mine. And even when you check your regular blood work, there's a range. So are you on the high end or the low end? If you're on the low end, would you need to draw more blood to get a certain standardized number? We just don't have that standardization. So we're all comparing apples and oranges to try to figure out what works. And
I wonder if that's the same for the PRP working, because, the science, again, same thing with PRP injections. There's not much research on it yet.
Yeah.
They're taking the plasma in this case. And I think you're right. How much blood, how much plasma, what is your ratio compared to others? Is that why it's working for some people and it's a 50-50 shot? Like, you're right. There's no standard, at least from what I've read, there's nothing standardized yet for that.
We're the industry, we're trying to develop those standards, but we just don't have them yet. And so people that get like the vampire facial and the PRP, there's a lot of people that it works and it's helped them. And there's a lot of people that say, didn't really help. And so I think a lot of that just stems from that, but it's definitely trendy, and a lot of people are getting it. And I think social media and certain celebrities have really made it big, but vampire facials actually been trademarked by somebody, I think. So you can't use the word vampire, you can't market vampire facial unless you pay them a royalty or something, or a licensing fee or something.
Oh wow, I didn't know that.
Yeah, so there's a whole business side of it now too.
Of course, there's always a money thing attached to it. So here's a going off of what you said before on this. What do you do for someone who has discoloration in their skin? So you're talking about like the, brown marks or maybe scarring marks. I guess when like you get older, there's like a lot of brown spots, or you get like the dulling around the eyes. So what do you recommend for stuff like that for skin pigmentation?
Sure, depends on the type of pigment. If you're just talking about what people used to call like liver spots, which have nothing to do with the liver and all 100% due to the sun, first thing I make sure is they're just that, because there's a type of melanoma, because those brown spots are called lentiginous, or a lentigo, it's singular. But there's a type of melanoma called a lentigo maligna, which looks very similar, tends to be on the face. So you don't want to miss the melanoma by trying to treat just a brown discoloration. And then to basically lift that pigment, there's things you can do, like there's things that help to lighten the skin. You can do chemical peels. Lasers are very easily can target it. Retinols, microneedling. There's lots of things you can kind of throw at it. So it depends on where it's at and how deep the pigment is. But one thing's for sure, especially in South Florida, no matter what you use to treat that, or what way you treat it, if you don't wear your sunscreen, then it's just going to come back. And so you'll be wasting your time and money. And so I tell patients, unless they're motivated with their sunscreen, don't even bother. I'm upfront with them, and I tell them it's just going to come right back. With melasma, other types of pigment on the face, there's some topicals you can try. If not, people are using tranexamic acid, which is oral. You just got to be careful you don't clot. So it's kind of a new thing that a lot of derms are using and getting some benefit. And pigment under the eyes, that's tough. That's really tough, because this is the thinnest skin we have. And a lot of times what you're seeing is not necessarily pigment, but the blood vessels underneath. As we're losing the bone and things are getting wider, and the fat pad of the eye is coming out. And that's when people get, like, usually with like a oculoplastics, they get a lower lid bleph to take care of that. But this is tough down here, and sometimes getting filler here doesn't necessarily affect the pigment. So honestly, as cliche as it sounds, the best thing is to try to avoid it with sunscreen.
Do you believe that actual, like, these creams on the market, these like anti-aging creams on the market, do you think that, or do you know if those actually work with like helping the face, like a certain
some do.
cream?
Some do, many do not. For example, a lot of the ones that You put it on, and all of a sudden it looks like all those little fine lines magically go away. A lot of it is some of those weak acids that actually irritate the skin. And what that does is it irritates the skin, so water goes in because the body's trying to now, there's inflammation, the body's trying to heal. And then what that causes is just a mild swelling. And so, yeah, the wrinkles disappear, but it's temporary. Or as the light hits your face, the way the light bounces off is slightly different. And so then it's a temporary look. It does not necessarily that it builds more collagen, or think about it, the skin is made to keep everything out as much as possible. So it's very difficult for products to actually penetrate the skin.
It's amazing. It's amazing. You know, all these things that like you truly, like you said, I think social media now has a big thing to do with it, but you know, you see all these ads, you see all these high-end celebrities promote these certain products and their own products, and they made this and blah, blah, blah. And then you got to find out what works and what doesn't. But I see so many people like use all these different things or promote these different products. And it's like, okay, is it really doing that though? Or are you just wasting money and putting it down the drain?
It's hard, and it's hard to figure out what works, which is, I mean, one of the things we do is we have a thing where from Skin Type Solutions, where we try to basically figure out the kind of skin you have. And then we've looked at all sorts of products that we know work specifically for each type of skin. So then, you know, instead of going on and seeing, you know, here's 50 moisturizers, and you're like, which one do I pick? It's like, all right, we know these work, and we know these work for your skin type. And so it's a different take on it to try to basically cut out all that, like you said, on the market, where which one do I pick? There's 100 sunscreens, you know, there's 100 under eye creams. What works, what doesn't? So we've done a lot of that research and that legwork through Skin Type Solutions and through Dr. Leslie Bauman as well.
Amazing. All right, so I'm gonna taper this off. What I want to give you an option to say, and this is a question I didn't really get to throw at you, but what are your top 3, I guess, tips for people as we sign off on this episode with you?
So I would tell people less is more, and it's one of those where we tend to be doing too much with our skin, and sometimes going back to the basics is what's important. And we need to do things consistently, which could be said about anything: working out, diet, anything. And this way we can age gracefully, age healthy, and do things little by little versus just, you know, going in and doing too much all at once, because the skin it takes time for things to slowly change like that. And look at some celebrities; they look phenomenal over the years because they've gone little by little. Jennifer Aniston, for example, she's aged extremely well because she's gone things little by little. So I think that's the first thing. Protect the skin, and again, smoking causes a lot of changes in the skin. Sunscreen and reapplying, just that alone can help tons of patients out. I mean, I cut out skin cancer all day, every day, and a lot of that can be avoided. And so I think prevention is better than treatment. And if we can kind of wrap our heads around that, not just in skin, but in everything in healthcare, we can have healthier patients, and I think it'll be better for everyone. So.
I love it. All right, so why don't you tell everyone where they can find you or where they can reach out to you, whether that's for setting up an appointment, finding you on social media, or however you end up scheduling your patients.
Sure. Well, our office is located right across the hall from yours. So we're just there on 800 East Broward Boulevard. We're on the first floor, across the hall from Dr. Marron's office. Our website is Galt, G-A-L-T, dermatology.com. And we're on Instagram as Galt Dermatology as well. And so they can reach out to me on Instagram, or go online and you can book online, or you can even call our office, 954-463-5406, and Andrea or Alex will help answer the phone and get you on the schedule.
Perfect. And I'll put all that in the cliff notes on this episode too. I'm gonna sign off, guys. Thank you again for viewing in. This is episode 6 with Dr. Miguel Villacorta, and I'm looking forward to having him back on again. So any questions that you guys feel like you wanted to ask him after we got the ball rolling on this one, we'll put into our next episode. Miguel, thank you so much for deciding to come on. I know you're super busy with life and your practice, so I really appreciate you taking out the time on your Sunday to do this with me.
No, of course. Thanks for having me on. This was fun. I love answering all these questions, even if I go in circles with some of them. I enjoy doing it, and it's what I do when I see my patients, and that's why I take the time with them, because you got a question, and I'll just start going off.
No, it
so
definitely
thanks again.
matters. You're very welcome. All right, I'm gonna pause this.